Good afternoon. Thank you for joining us. Today we had 15 new cases of COVID-19 here in Hawaii. I know that everyone noticed the increase over the last week or so. This was expected as we began the phased process of reopening businesses and activities. Just want to assure everyone that it's a manageable number that we have prepared for. We still continue to have amongst the lowest number of new positive cases in the country and the lowest level of hospitalizations as well as mortality. And so thank you to everyone for doing your part in honoring and implementing the physical distancing and other mandates that we asked all of you to sacrifice for. We do know as more businesses and increased activities occur, we anticipate that we will see a gradual increase in the number of cases. I think most importantly, want everyone to be assured we are prepared for this increase. The healthcare system in the islands have been monitoring activity. We have daily updates on utilization that assures us that we have the capacity in our system to deal with these levels of cases. I know that one of the big highest number of questions I get is about our kupuna in long-term care facilities. We all know that they're a high-risk group. We have seen the stories and the national highlights of the increased number of cases and deaths in long-term nursing facilities all across the country. I just really want to assure you that we have great long-term care facilities in the islands. The industry has been very aggressive in implementing the protections and recommendations of the CDC and the industry. And we have not seen outbreaks occur in the nursing homes and care homes here in the islands. We've only to date have had one case of COVID-19 in a skilled nursing facility. And we've been working very closely with the industry to assure that our kupuna and seniors are protected. Dr. Bruce Anderson from the Department of Health will be providing an update on the cases, and Hilton Reatho, the President and CEO of the Healthcare Association of Hawaii, will be providing an update on all of the actions taken to protect those in long-term care facilities here in the islands. As an alumni, I'm very proud that the University of Hawaii is at the forefront of COVID-19 treatment research. Researchers at the UH John A. Burns School of Medicine will be launching a clinical trial for a drug that could treat COVID-19 infections. With me today is Dr. Cecilia Shikuma, Professor of Medicine at JABSOM, to give us a briefing on the important effort. I know that there has been much questions about out-of-state travel and when can we start to reopen the visitor industry here in the islands. As I announced earlier, we continue to make plans and make significant progress on bringing visitors from out of state back to the islands. We're taking a phased, multi-layer approach. No single element is perfect, and we plan to bring a layered system of screening and testing that will assure the health and safety of our communities. As you may know, I did appoint Lieutenant Governor Josh Green and Dr. Bruce Anderson to lead a committee investigating new methods to test trans-Pacific travelers and create a system of testing and screening to reopen travel on a limited basis to Hawaii. I also appointed Mike McCartney, DBEDT Director, to work with me on exploring international travel corridors to Japan, Korea, New Zealand, and Australia as a starting point. obviously looking for those communities where the prevalence of the virus is similar to here in the islands, and that we can establish travel between our countries in a way that allows us to keep our community healthy and safe. I also appointed HTA President Chris Tatum to lead the committee to work on guidelines in the hospitality industry, from hotels to visitor attractions. We want to create a partnership where we all are aware of the health and safety of the guests who visit here, as well as our community in general. They will be working on guidelines and standards of what our industry needs to do to be full partners as we reopen Trans-Pacific travel. There's a lot of details that we're working through, and just want to assure you we'll be making an announcement about how to safely reopen Trans-Pacific travel in the next few days. Our primary focus, again, is to ensure the health and safety of our community, but we recognize that we need to balance the social and economic impact that the pandemic is having. We intend and probably will have to maintain the 14-day mandatory quarantine, even as we bring and reopen travel from around the Pacific. We need to continue to quarantine travelers who are unwilling to follow our increased standards, because we know it's important to keep our community safe. Certainly looking forward to, as I announced earlier this week, the beginning and reestablishment of inter-island travel on June 16th. Certainly the opportunity for families to reconnect. I know that many have asked when would the quarantine for inter-island travel be dropped, because they have put off family visits and reconnecting in their ohanas since this COVID pandemic has started. Want to emphasize with everyone, inter-island travel is changing, and it will not be the way that you remember it. So please go to the Hawaiian Airlines website, and we'll be announcing a little bit in the next few days about what the new process will be. There is a new mandatory health form that all inter-island travelers will be required to fill out before boarding the airlines. I want to also remind everyone that those with a temperature above 100.4 degrees will not be allowed to board any inter-island flight. Certainly all of these new procedures are fundamentally important to restoring inter-island travel in our community. So I just really want to thank everyone for their efforts, for their sacrifice. We know that we can only be successful as a community, and I appreciate everyone doing their part, staying home when you're sick, keeping your children home, washing hands and using hand sanitizers. Most importantly, maintaining physical distance, 6 feet of separation. And please take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Thank you, Governor Ige. Our next speaker will be Dr. Bruce Anderson, Director, Department of Health.
Aloha, everyone. Over the last few weeks, we've been conducting outreach activities in Kalihi, Pololo, Waipahu, and other areas, focusing on some of the low-income areas in these regions to follow up on cases that we've had in those areas. Over the last weeks, we've had a handful, and as we've investigated those cases, we're identifying new cases and of course, working to isolate them and provide outreach and education to those communities. Today we had a total of 15 new cases, but 10 of those cases were all from the same household of a previously confirmed case. We have placed all those who have been identified as positive cases in quarantine, and we are continuing to investigate those to be sure that we've identified all the close contacts. By the way, there were 6 children and 9 adults in that altogether today. The other cases were all associated with previous cases or investigations that we have underway, which is reassuring in many ways in that we aren't seeing a lot of widespread illness. The cases we're seeing are associated with known clusters of cases or other known cases here on Oahu. So we have the situation well under control, as the governor pointed out. But it does point to the importance of keeping to the restrictions that we have. There is still virus in our community. It is very infectious, and we need to be sure we're not letting up on our infection control measures. I'd like to spend a little time today talking about our long-term care facilities. They're, of course, a very high risk, and many of the cases on the mainland can be attributed to outbreaks in long-term care facilities. We've been very lucky here. As the governor pointed out, we have had only one patient or resident in a long-term care facility who's been identified as positive, unlike the mainland U.S., where there are literally thousands of people every day being infected, and that's a major issue there. As we reopen the economy, there are concerns about increasing the risk to seniors, especially those in long-term care facilities. As we have prevented outbreaks in our long-term care facilities, I should note healthcare providers have taken many important precautions to protect the seniors, the kupuna, in their care. This hasn't been without cost, as families have not been able to physically visit their loved ones, and the separation from our kupuna has been difficult for many of us. Skilled nursing facilities have been able to receive grants this month through the Department of Health from CMS to purchase video communication technology to help bridge this gap. 23 facilities in our counties received a total of $30,000, and we plan to distribute another $30,000 in grants next month for video communication equipment so that people can at least remotely have conversations with their loved ones in that facility. The Department of Health has been working with long-term care facilities to ensure they have protective policies and procedures in place. We have a team dedicated to preventing and responding to outbreaks in healthcare settings, should that be necessary, including long-term health care facilities. Our team has been conducting infection control assessments and response meetings by phone. They've been doing that since May 18th and have completed assessments on more than 37 facilities. We anticipate reaching all 48 skilled nursing facilities in the state by June 18th. Through these meetings, we can answer the facilities' questions in detail, identify address gaps, and provide technical assistance as they refine their COVID response plans. They all have very specific response plans to deal with COVID-19. Building off this model, the team is also developing strategies to provide similar assistance and guidance to adult residential care homes. By the way, we have 438 adult residential care homes in Hawaii and 12 assisted living facilities. Our long-term care facilities in Hawaii have done an excellent job and continue to work closely with the department as cases are identified. To date, there's been only one positive case, a patient of a care home. This was a care home on Maui who tested positive after being transferred from a hospital with an outbreak that ended last March. That outbreak is now under control. We haven't had cases in more than a month, and that patient, by the way, was isolated in the care home, and there was no evidence of infection of anyone else in that care home. Yeah, it was very well managed. The department has advised long-term care facilities to conduct active surveillance of staff and residents daily. This includes daily assessment of all staff for any symptoms or possible exposure on entry to the facility and at the start of each shift. Staff with symptoms or possible exposure are tested and then sent home from work. Facilities are also advised to conduct assessments of all residents daily, 2 or 3 times each day. This includes checking for fever, coughing, breathing difficulty, and determining any possible exposure through close contact. COVID-19 is an urgently notifiable condition in Hawaii, and providers are required by law to report any person suspected or confirmed to have COVID-19 or any positive test result. All long-term care facilities report any issues to the Department of Health immediately, and we investigate quickly before the results are even available. This includes positive cases both among patients and staff. We have a 24/7 reporting line for all providers so that we can act immediately. They are our highest priority, and we respond immediately when we do get calls. The department also receives electronic laboratory reports from all clinical laboratories for COVID-19 test results and reaches out to facilities to follow up on any reports of cases with a history of being at a long-term care facility, whether it's a resident, a staff, or a visitor. And finally, any confirmed or suspected case in a long-term care facility prompts an urgent investigation. The priority response from the department includes infection control recommendations, quarantine and isolation of residents and staff, requests for updated lists of individuals and other additional information, on-site assessment, and additional testing of residents and staff. We've had three cases of individuals in care homes last week. Fortunately, these were not patient care, involved with patient care. They were workers at the facility in the kitchen and had no exposure to patients, and we found no evidence of any exposure. In those situations, we've tested, I think it was over 140 staff and any patient who wanted to be tested, and we found no additional positive results. So that situation was well contained. So throughout the pandemic, our department has continued to conduct on-site inspections on licensed health care facilities, including skilled nursing facilities and residential care homes. We're doing so regularly, and we include detailed focus on infection control and the well-being of residents. Today, we are currently investigating a case of a healthcare worker at one of our nursing homes. It's one of the largest nursing homes in the state. We're fairly confident that the individual did not infect staff or any of the other patients. They had implemented very strict infection control measures, and we are following up. And as a precaution, we are testing all the staff and the patients in the units where the case worked. So hopefully we won't see any further cases there. So again, we're not seeing the situation here in Hawaii that we've seen in many places in the U.S. We have our nursing homes are safe, and they certainly have state-of-the-art procedures and infection control practice in place. Thanks very much.
Thank you, Dr. Anderson. Our next speaker will be Hilton Raithel, President and CEO, Healthcare Association of Hawaii.
On Thursday of last week, as Dr. Anderson reported, 2 employees at one long-term care facility and 1 employee at a different long-term care facility tested positive for SARS-CoV-2. The 2 employees who work in one facility are members of the same household. The employees who tested positive were discovered through employer screening. One employee had a headache. From that single potential symptom, a test was done and the discovery of COVID-19 made. The employees who worked in food service and housekeeping were immediately self-quarantined. As Dr. Anderson just stated, there is no evidence that transmission of the disease occurred in the facility. All staff and residents of these 2 facilities have been offered COVID-19 testing, and all tests conducted to date have come back negative. We are much better prepared for this disease than what we were when the pandemic began months ago. Long-term care facilities screen all employees and anyone entering the facility every day. They have shut down visitation except in very limited cases, such as the end of life. And we know this is challenging for family and friends. Our facilities are providing remote communication devices whenever possible, and we appreciate the funding from CMS and the Department of Health to purchase additional devices. Our facilities ensure hand sanitizer and appropriate PPE is available. Masks are required for all personnel in patient care areas. Staff are required to wash their hands frequently and engage in a litany of infection control measures. COVID-19 infections in long-term care settings are a reflection of the amount of COVID-19 in the community, as has been documented by public health experts at Harvard, Brown, and other organizations. Hawaii's long-term care facilities have been protected from COVID-19 because we've been successful as a community in keeping the incidence low in the state. According to the latest data from CMS, as shown in this chart, Hawaii has the lowest rate of COVID-19 infections in nursing homes of any state in the nation. On this side of the chart are states such as New Jersey, Connecticut, and Massachusetts, and right on this end of the chart is Hawaii. We don't even have any color on that chart to show up on the chart. We encourage each of you to maintain physical distancing when appropriate, wash your hands with soap and water, keep your hands away from your nose, mouth, and eyes, and wear a mask when entering enclosed spaces. The federal government, via the Centers for Medicare and Medicaid Services, has issued recent guidance on long-term care. HEH and our members have been working very closely with the State Department of Health on policies for facilities here in Hawaii. We have a much better ability to test for COVID-19 today than when the pandemic began. This means having sufficient PPE and testing materials, including swabs and reagents. The Healthcare Association of Hawaii and its Emergency Preparedness Program continue to work with state and federal agencies to ensure access to PPE and other medical supplies and equipment, not only for hospitals and long-term care facilities, but many other healthcare organizations across the state as we work to battle this emergency. We're also working with our hospitals, including the Queen's Health Center, to set up the federally funded Battelle system, which will allow us to sterilize N95 masks for reuse. We continue to work with other hospitals and systems on other sterilization processes. We are all working to ensure that we have enough PPE, supplies, and equipment, not just for today, but for the weeks and months to come. Thank you.
Thank you, Mr. Rafo. Our next speaker will be Dr. Cecilia Shikuma, Professor, John A. Burns School of Medicine.
Thank you. I'm pleased to announce today our John A. Burns School of Medicine's first COVID-19 treatment study. It will focus on 40 adult outpatients newly diagnosed to be positive for COVID-19. The study will be 21 days in duration with close monitoring of participants throughout the study. We will be asking participants to take their temperature and blood pressure at home. The objective of the study is to try to minimize the severity of the lung and heart complication that COVID-19 leads to, that lead to hospitalization. We believe that vaccines obviously are necessary to prevent disease, but drugs that can minimize the harmful effects of COVID-19 are likely to also have major public health benefits. Study participants will be given placebo or a sugar pill or an already FDA-approved blood pressure medicine called Telmisartan that has its beneficial effect by affecting our hormonal system that controls not only blood pressure but also inflammation and fibrosis. This hormonal system is called the renin-angiotensin system. We hypothesize that much of the harmful drugs of this virus is due to the dysregulation of this hormonal system, wherein the harmful effects are amplified and the beneficial counter-regulatory, anti-inflammatory, and anti-fibrotic effects are minimized. If this small pilot study is successful, We hope to then apply for funding, possibly from the National Institute of Health, to fund a much larger, perhaps national multi-site study to further study its potential as a treatment modality for COVID-19. We hope that you will not get sick with COVID-19. But if you do, please visit our John A. Burns School of Medicine website for more information. Thank you.
Thank you very much, Dr. Shikuma. Reporters, we're going to now shift into our Q&A section. And the first reporter question comes from Audrey McAvoy.